Welcome, everyone. I'm Brian Pugh. I'm the Executive Director of the Brain Injury Association of Maryland, and we are glad that you've chosen to spend some time with us learning about brain injury and post-traumatic stress disorder. We believe this is a really important topic and are glad that you're taking the time to join us in this overview. It's a brief overview of a very complicated topic, but I think you'll find it interesting and informative. So to begin with, I'm not a doctor. I'm not a psychotherapist. This presentation is for information and awareness purposes only. Both brain injuries and PTSDs are very serious medical conditions and need to be diagnosed, treated, and monitored by trained medical personnel. We believe it's a very important topic that needs to be discussed so that more people can be aware of it and find out the connections that we believe happen between PTSD and brain injury. And we want to start with some of the terms and definitions. So the introduction is we're going to look at the types of brain injuries and symptoms. And I will tell you that, we're going to be talking about a lot of different things. I'm going to try and relate it to you, but, when we're talking about symptoms and definitions to try and, sort of rein in this issue and get on the same page about what we're talking about, the terms, it's going to require a little bit of going through because these are such complicated issues. We're going to address the diverse causes and symptoms of PTSD. We're going to then sort of explore the overlap between PTSD and brain injury. And then we're going to explore some of the treatments for individuals with brain injuries and PTSD. So that's kind of a roadmap of where we're going today. So to begin with, I want to start with talking about acquired brain injury, because there's a little bit of misunderstanding about this. And so a traumatic brain injury usually results from a violent blow or jolt to the head or body. And that's kind of what the public is familiar with, and it may be something you're familiar with. You've heard about TBIs, you've heard about chronic traumatic encephalopathy with the sports injuries that are happening and people that are getting, forensic diagnosis of these damaged brains that after years and years in the sport. And so many people think of traumatic brain injury as brain injury, and so they sort of intersperse brain injury and TBI is kind of the same thing, particularly, when we had the great awareness around concussions. We had football concussions and we had baseball concussions in hockey, and they were including new concussion protocols. They've had, lots of information about injuries from the conflicts we've had in Iraq and Afghanistan and those wars. And the premier injury of those wars is, traumatic brain injury. So, but the way we discuss it at the Brain Injury Association of Maryland, and the way I want to try and have you be more informed and thinking about it is that a brain injury does not necessarily just have to be traumatic. I mean, there are different types of brain injuries, and there can be, and we'll talk about that a little bit, traumatic brain injury and non-traumatic brain injury. Now, that's kind of a misnomer because every brain injury is traumatic. But the reality is, in describing a traumatic brain injury, we're talking about a blow or jolt to the head. So that's where you're thinking about the sports concussions, where somebody gets hit really hard and they take them off the field to see if they've had a concussion, where you see a race car driver have to get pulled out of the car because the forces or a wreck. You're going to hear, maybe you've had an experience yourself with a car crash or something like that, where you've had sort of a concussion. But we want to expand your vocabulary, and we want to expand your knowledge of brain injury. And so when we talk about acquired brain injury, an acquired brain injury is an injury to the brain that's not hereditary, congenital, degenerative, or induced by birth trauma. So what does that really mean? So when we talk about acquired brain injury, we're not talking about degenerative things like Alzheimer's or maybe Parkinson's. We're not talking about dementia, although those things may arise as a result of a brain injury, a long-term brain injury. But when we're talking about, or we're not necessarily talking about a birth injury, so we're not really talking about cerebral palsy in that regard. And it's not something that may be congenital, meaning that, you were born with this injury. There's a missing gene or something that's creating this brain injury that your family has passed down and that your family has. What we're really talking about is something that happens after birth, but not degenerative. And so ABI, acquired brain injury, is kind of an umbrella term for all brain injuries. And what we're really talking about is an injury that changes the brain's activity and makes functional ability of the nerve cells challenged or damaged. Okay. And so we typically we kind of break it down, like I said, into two kinds. We've got the traumatic and non-traumatic. Now, I'm not crazy about this non-traumatic term, because anybody who's had a concussion knows it's traumatic to your life. Anybody who's had, a stroke, knows that it's pretty traumatic. But what we're really talking about when we're talking about trauma is we're talking about impact. We're talking about, a force or alteration of brain function as a result of an external force. Okay, so that's when you're really thinking about, something happening like that. And when we're talking about non-traumatic brain injuries, those are going to be things that happen within your body, right? So that's going to be a lack of oxygen, you're drowning, or like an overdose, and exposure to toxins, you're inhaling something that's affecting your brain. And then sort of, pressure from a tumor, or maybe even an operation where they have to go in and take something out. That would be, the pressure that they're trying to relieve would be a non-traumatic brain injury, but the actual surgery itself we would consider traumatic, because what are you doing? It's an outside force going in to try and talk about it. So it's, it's really a way of distinguishing different things, but the reality is, we consider all of that, acquired under that big umbrella. And so we've got traumatic brain injury examples are like falls. I hit my head. I fall on, I'm in the bathroom. I slip. I hit my head on the sink. I hit my head on the ground. Assaults. I'm getting beat up. I get thrown up against a wall. I get punched. Motor vehicle accidents. These are very these are probably one of the more common ones that people encounter. I'm in a car crash and my head rolls around. I get bumped. I can get an airbag. An airbag comes, and just the striking blow of the airbag can give me a traumatic brain injury. Sports injuries, those are the ones we've talked about that we're familiar with, the repeated hits, the boxing, the lacrosse, the football, those kinds of things that you're seeing repeatedly. And then of course combat injuries, and so like we talked about, the distinguishing injury of the war in Afghanistan and Iraq were these IED explosives and exposures to those explosions that and that became, a recurring theme of having these recurring brain injuries. Now, interestingly enough, many of the brain injuries that are occurring subsequent to sort of our, removing ourselves from the war for the most part, they're now non-combative brain injuries, but they're nonetheless continue to be a significant issue. And then when we talked about non-traumatic brain injuries, and again, I hate that term, but it's because it's the force, it's the outside force. Strokes, a near drowning, an aneurysm, where the blood vessel is getting enlarged and may burst, a tumor, and then sort of lack of oxygen to the brain, like an opioid overdose. So they're kind of categorized into three types of brain injury, and so the vast majority, 80%, are considered mild. And the way that they sort of distinguish, and these are kind of they get kind of gray in the middle, and that's why they have this sort of fluctuation. But most brain injuries, particularly traumatic brain injuries, they have a loss of consciousness of less than 30 minutes, an LOC, loss of consciousness, and a post-traumatic amnesia of less than an hour. It means I can't remember the circumstances for about an hour when this brain injury occurred. And now I need to completely emphasize, you do not need to lose consciousness to sustain a brain injury. That's a complete misnomer. If anybody says, oh, lucky he didn't get knocked out, that has nothing to do with the brain injury. In fact, only about 10% of the people actually lose consciousness that have a traumatic brain injury. So we get into 10 to 13%. Again, that range, because it's kind of a little bit gray in the middle there. So you get a loss of consciousness for 30 minutes to 24 hours, and then post-traumatic amnesia for 1 to 24 hours. Okay, so those are considered more moderate brain injuries. And then the severe, which is again the range 7 to 10%. Loss of consciousness for greater than 24 hours. I don't remember the week. I have no memory of that month. Or post-traumatic amnesia of I don't remember long periods of time. So the loss of consciousness can maybe be somebody, I was in a coma, and then the post-traumatic amnesia is like it's a blank. I wasn't there. So those are the most severe kinds. Now I will tell you that just as a side note, there is a movement within the research, and within the practitioners to try and move away from this sort of arbitrary bucket of putting you in a mild, putting you in a moderate, putting you in severe, because of the, the spectrum of symptoms that happen, and they can kind of come and go, particularly the fact that, you don't need to have a loss of consciousness to have a pretty severe brain injury. And so what they're trying to move towards is sort of the spectrum of symptoms, and you can trigger, like, not unlike the spectrum of symptoms for autism, and in rating autism and determining autism. So it's terms of, a scale up and down, so that you're not necessarily saying, okay, well, you meet this criteria, so we're dropping you into the mild bucket. It's like, there's nothing mild about my brain injury. But that's still coming, and you will still hear people routinely talk about it was a mild traumatic brain injury or mild brain injury, had a moderate traumatic brain injury or moderate injury. But they're trying to move away from that, recognizing the nuances that are entailed when you're talking about somebody's brain. So it's going to look like a list. And when I was going back over this, I wanted to make sure that you understand that one of the reasons that I want to put this information in front of you and to talk about this, and we'll go over them briefly, is that since we're drawing a comparison and we're making connections between brain injury and the overlap between brain injury and PTSD, I want to at least establish a little baseline of things that are in brain injury and then things that are in PTSD, so that when we start making those connections and start looking about the challenges that individuals with brain injuries and have when they're encountering PTSD, or if you're being diagnosed with PTSD, to take a look and see if perhaps there was a traumatic event that was a brain injury. I want to put these in front of you, and so I want to go over briefly so that we can draw the comparison and contrast to some of this stuff. So, we're talking about symptoms of brain injury, persistent headaches that worsen. Fatigue is a huge issue with individuals with brain injury. You just run out of gas. Sometimes it's in the middle of the day, sometimes at the end of the day, sometimes you can't get out of bed. Sometimes if you exert yourself, fully for one day, it takes 3 days to recover from it. So another issue is dizziness and loss of balance, because, so much of your perception of your environment, it relies on your brain and your brain processing information coming in from the outside. You have a challenge in those kinds of neuropathies. Sensory problems, blurred vision, field cuts, meaning that my brain isn't able to process information coming in from my peripherals, or maybe I have a spot in the middle that my brain can't find. Bad taste in your mouth, everything, all of your sensors come through your brain, and some of these are very, very complicated. What we learned about COVID was, one of the onset symptoms there was loss of taste and smell. And people, made jokes about it and had a really good time with, oh, I'm going to eat the ghost pepper challenge or whatever. But the reality was that it was an actual brain injury, because their nose didn't fall off and their taste buds didn't jump off their tongue. The reality was their brain was damaged in such a way that it's no longer able to process the complex sensory information that's coming in, and can't discern smells and can't discern taste. And sometimes it resolved, sometimes it didn't. We're dealing now with individuals with long-term COVID that continue to have problems with taste and smell. So these are it's a brain injury. It's not something, physically wrong with your tongue and your nose. Sensitivity to light and sound. This is huge. Overwhelm. You'll see people that want to be in a dark room. They want to wear the sunglasses. They have colored lenses in their glasses now, because they're trying to prevent all of this coming in. Difficulty sleeping. The disruption of the circadian cycle in the brain is the rhythm of waking up and going to bed and waking up and going to bed. That's disrupted by brain injury. Sometimes sleeping more than normal. Sometimes, not being, going to sleep, waking up and can't go back to sleep. Insomnia, things like that. Agitation and combativeness. This is a real issue, that overwhelm, that too much sensory information, whether it be sound, sensitivity to sound, sensitivity to light, all of that coming in. It's just like, stop, and trying to shut down. Being dazed, confused, disoriented, memory and concentration problems. These are all things that you think, if your brain is not working appropriately, these are the kinds of things that are going to be happening. Feeling depressed and anxious. I can either feel depressed and anxious because I don't understand what's going on. I can feel depressed and anxious because I remember what my life was like before, and now I can't do it. So there's a variety of issues, a lot of mental health issues that can arise from brain injury. And then sometimes it's something like, maybe I had anxiety and feelings of depression, but I was able to overcome it. I had created some coping skills or coping mechanisms within my life, and the brain injury disrupts that. And then I can no longer really call on those cognitive, side ways around different things, and so that can create a lot of feelings of being depressed and being anxious. I just don't have the ability to cope anymore. Like the brakes are off of holding back those feelings. Cognitive behavioral mental health symptoms. This is a huge issue, trying to process information. Again, anything that you're trying to do that uses your brain, now that it's disrupted, is going to be an issue. So when we're talking about cognitive problems, what are we talking about? We're talking about memory. I have short-term memory. I have long-term memory challenges. Learning new stuff. I can read a page. I can read a page over and over and over again, but it's not going in. Or I sit and realize I've spent 45 minutes on this one page trying to understand the information. My judgment is off. I can't read people. I can't read social situations as well. Attention and concentration. Again, got so much information going on, and my brain is not able to process all the sensory information coming in, and I get stuck and shut down. And that leads, of course, to problem solving. I can't figure out what the next step is going to be. Planning. I really have no idea what to do next. Decision making. I don't know what I want. I don't know what to say. I don't, I'm looking at a menu and I have all these choices, and I'm like, I don't know what I want. I can't decide. And then beginning and completing tasks. I know this is what I want to do, but I don't know how to start. Or, yeah, this is great. This is great. Oh, I'm going to go over here and do this thing. These are all very, very typical things in brain injury. So the behavioral changes, and some of these are really challenging, particularly for family members and caregivers. So it creates a difficulty understanding speech and writing, difficulty actually speaking or writing. It doesn't make sense. You're not putting it together. Inability to organize thoughts, trouble in participating in conversations. And then, with that, it creates, behavioral issues. It becomes, oh, actually, I'm realizing I duplicated that. So behavioral changes are actually more that, I get angry very quickly. My perception is off, and I misjudge situations. I laugh at wrong times. I yell at wrong times. I blurt out things. I don't really necessarily have a censor on my thoughts. And then communication problems, which is the appropriate replication. So that's where you have the difficulty speaking or writing. You can hand it to me and I can read it and I don't understand it. I have trouble. I may have aphasia. I know what I want to say, but I can't find the words, and the words that I say are wrong. Inability to organize your thoughts. Again, I can't sort of make a cohesive point, or I walk myself into a corner and can't remember what I started talking about. And then again, that makes it really challenging. I know I've talked to folks, that can't watch movies anymore because they can't follow the story. They can't read anymore because they can't really keep up with all of the plot twists, and they can't keep up with the characters. And that becomes a challenge. Emotional changes. So this is the one I was talking about where, you may have been able to have coping skills to sort of deal with things, and sort of you had an underlying sense of depression, but you were able to kind of get through it. Now that you have this brain damage, you may not be able to have those coping skills available anymore. And so that's going to make you more depressed and create anxiety about, I know that's going to make me, going shopping with all the lights and the sounds and the colors and the choices. I know that's going to set me off. I know that's too much. I'm really nervous about it. And because I'm nervous about it, that makes me really irritable. I get really frustrated and angry about these kinds of things. I don't know what's going on. I don't know what I'm feeling. I don't know what the answer is. And then, the insomnia that creates, you start ruminating on things, and you can't really deal with them. And it keeps you awake, keeps you up. Sensory problems, you've got ringing in the ears, difficulty recognizing objects, again, impaired hand-eye coordination. So the proprioceptive, the ability to sort of reach out and touch things, grab things, know things, bring things back to you. Depending on what part of your brain is affected, that's going to be a challenge. I can see it, but I just can't grab it, or I can grab it and I've got blind spots, so I can't really find it effectively. And then again, balance and dizziness. So those are kind of a laundry list of things, but it's also very important to understand so that when we talk about post-traumatic stress disorder, we can start taking a look at, some of the signs and symptoms of PTSD. And I'll be calling it PTSD throughout, but PTSD, and see, and as we start moving closer and closer to find out those, that overlap and those connections. So in terms of post-traumatic stress disorder, it's typically called a mental health condition triggered by a terrifying event. It's kind of the layman's term. Either experiencing it or witnessing it. And it can be first person witnessing, and as we'll see later, maybe not even first person witnessing. But that is kind of, it's something that is triggered by a terrifying event. And so that can be a variety of things. And so most people who go through traumatic events, as we all do, we all have experience in this kind of thing, some to a greater degree than others. They may have temporarily difficulty adjusting and coping. So it may throw you off for a while, but over time, and if you with good self-care, you usually get better, right? The vast majority, just like the vast majority of brain injuries, resolve in 3 months to 6 months. And if it doesn't resolve, then you start moving into more of the moderate and the severe category, right? So if your symptoms get worse or last for months or even years and interfere with your day-to-day operation, you may have post-traumatic stress disorder. And what's interesting is that anyone can develop PTSD at any age. And unfortunately, recently in the news, we're very familiar with opportunities for people in all age ranges to be subject to traumatic events and terrifying events. So I can think about, the school shootings, particularly. You've got young kids witnessing their classmates getting shot, witnessing their classmates dying, witnessing the excitement and terror and fear of, running from a classroom with all these police and all the lights and all the guns drawn and all the grownups freaking out and all of this stuff. So you have, very young kids being subjected to this, and also, young people and teenagers, right? Attacks on churches, synagogues, and temples. We've had those kind of assaults. And so those are going to be groups of people from all ages. You're going to have, the 80-year-old shot and murdered, and you're going to have, maybe a 9-year-old shot and murdered. I mean, you have drive-by shootings, you have shootings in gatherings. And those can all be not only the people that are directly involved, but the family members that are involved as well. You can think about random bombings like the Boston Marathon, where I was there to cheer somebody on. I wasn't at the bomb site, so maybe I wasn't injured, but I was 1 block away. Or my loved one I couldn't find for hours after that in the tumult, right? And so that can be very problematic. You can think about the people that were there at the January 6th riots, the Capitol Police that were there at the January 6th riots, the Congress and House of Representatives and the Senate that was there and meeting in chambers and having to sort of run down the hallway for their lives with these people screaming, "Where are they? Where are they?" That, or the staff members. I remember, what was it? Nancy Pelosi's staff members behind locked doors, huddling in the dark, being perfectly silent while people were trying to find Nancy Pelosi to kill her. They weren't looking for them, but they were, absolutely terrified as they could hear these crowds and crowds and crowds of people screaming and chanting, walking past that locked door that they had barricaded up against, praying that nobody would come in and find them. Even police actions and protest marches. We saw a lot of that during the Black Lives Matter movement, and the many protests that surrounded, the unfortunate murders of a variety of individuals that sort of culminated in the George Floyd murder. So you've got those kinds of people that are participating in those. We think we're going out for a peaceful march, and then all of a sudden, cars are burning and people are running and glasses getting shattered and I'm running from the police. People living in distressed neighborhoods, this can also create PTSD. And then, of course, we've seen a rise in attacks on ethnic groups and, the LGBTQ community and the elderly. So these are all things that show it's from, birth to death, anybody in between can have traumatic events that can trigger and create PTSD. Does that mean everyone gets PTSD? Not necessarily, but it does mean that they are susceptible to it. So we're talking about combat veterans, people who have experienced or witnesses physical or sexual assault, abuse. We're having in Maryland, we're having this huge issue, and I guess in some other states around the country. The revelations and the naming of names within the Catholic Church, of the abuse that's taken place. Significant opportunities for post-traumatic stress for all of that, not only in challenging your own mental health, but also your faith, which can be strongly tied to your own mental health and well-being. So one of these challenges of PTSD is you can feel stressed and frightened even when you're not in danger. You're just on high alert, and you don't know what's going on. One of the stories that I tell when I was legal advisor to the Florida Highway Patrol, I did that for 5 years, and I remember one trooper was talking about he was a veteran. He was a veteran from the Afghan War. I think he did 2 tours. I can't remember exactly, but he had been in Afghanistan for a number of months. Came back and then enlisted in the Florida Highway Patrol. And one night he came up in a neighborhood. He was off the highway. He was going through a neighborhood, and he saw a car driving about 15 miles an hour in the middle of the road. And he followed this guy or the driver, didn't know who it was, but ended up being a guy. Followed this guy for maybe a mile, and he just sat in the middle of the road on the center line for at 15 miles an hour, just going. And so he flipped his lights. The guy pulled over and he came up on him, and he knew right away. He went in and guy rolled down his window and he said, "How long have you been home?" And the man burst into tears and said, "I've been home 3 weeks." And what he was doing was, when he was in Afghanistan, that was the way the convoy would proceed. You would proceed in the middle of the highway to try and be away from the sides of the road where the IEDs were planted, and would blast into the roadway, or you would drive in the middle and try and watch very carefully, driving 15 miles an hour, just head on a swivel. And so he, the trooper instinctively knew, because of his experience there, said, "I don't know what this guy's doing." And so here he is, experiencing these events and being on high alert. And we'll talk a little bit more about being agitated, high alert, simply because that was the way he was dealing with being back and driving again. And so the trooper ended up taking him home, driving with him back to his house, and getting him in touch with medical services. I think it was through the VA, to try and get this guy some help, because clearly he was not in danger, but was still stuck in that place. And, we also talk about, not everyone with PTSD has been through a dangerous event. Sometimes learning that a friend or family member experienced a trauma can cause PTSD, right? So I've also thought about this a little bit, where, maybe witnessing a difficult sports injury on TV. I'm kind of reflecting on the Buffalo football player, was it Damar Hamlin, who had a cardiac arrest on the field, and kind of everybody sat there and watched this happen in real time, and watched the teammates just lose it. And we, come to find out he died twice on the field and was revived and taken away. And just that whole moment in the country where anybody who'd been watching that had been affected. We weren't there witnessing it. Maybe we weren't sitting there with his teammates on one knee, watching the caregivers desperately try to bring him back. We weren't necessarily in the stadium watching this occur real time. We were, we're sitting at home in the comfort of our own living room. But it could very well trigger challenges. It can very well trigger events. Going back to that, it can be very, very scary. And so even though we weren't physically there, though, it can maybe trigger, has the possibility of triggering, some kind of post-traumatic stress on that when those kinds of events if it's happens again, and all of a sudden, brings up all those feelings. Or maybe having a family member describe living through the Holocaust in World War II and the horrors of Nazi Germany. Listening to grandmother describe all this stuff to you, and then all of a sudden, start seeing events that are happening in the world today that look a lot like things that maybe were happening that grandma talked about, in Nazi Germany, and triggering challenges there. So it's all possible. So symptoms of PTSD typically begin within 3 months of the traumatic event, but sometimes they can just erupt later. And to meet the criteria for PTSD, a person must have symptoms for longer than 1 month, and the symptoms must be severe enough to interfere with aspects of their lives. And we'll talk a little bit about more specifically. It also, in order to be diagnosed PTSD, it needs to be unrelated to medication, substance use, or maybe other illnesses. So they want to, when the trained neuropsychotherapist or the trained doctor is sort of discerning this, they're trying to parse out some of these things and making sure that we're not related to your drug use. It's not related to maybe some medications that changed. It's maybe not another illness going on that we need to investigate. So when we're talking about PTSD, these are the symptoms that an adult needs to have in order to sort of have a definitive PTSD diagnosis. And so everything has to happen for at least a month. So it's not like one day I have a bad day, or over a course of a week I have a couple of bad days. So at least one re-experiencing symptom, at least one avoidance symptom, at least 2 arousal and reactivity symptoms, and at least 2 cognition and mood symptoms. So there's a criteria set up. There's a metric side, that anyone who is trying to diagnose PTSD is going to use to try and work through and figure out, is this person truly having a PTSD, or is it something else we need to investigate? And so we'll explore that a little bit, point by point. So what's a re-experiencing symptom? Well, that can be flashbacks, and that's probably the one that is in the movies. It's the one that we most see in novels and books. It's the one that we hear about most. People make jokes about it, although it's not funny at all. But it's sort of reliving the traumatic event, including the physical symptoms. So that means my body is in the moment, in the terror, in the fear. I'm having the shortness of breath. I'm having the running heart. I desperately want to get out of the situation. I'm uncontrollably crying. I am so terrified. And so that considered, is a re-experiencing. Recurring memories and dreams. Every time I close my eyes, I see the wreck happening. Every time I close my eyes, the bomb goes off. And then having those distressing thoughts around that, so that it not only affects that, disrupts my sleep because of the nightmare, but I wake up and I can't stop thinking about it. And then, of course, I'm experiencing physical signs of stress. I'm not eating as well. I don't want to get out of bed. I'm experiencing fatigue and pain, right? Avoidance symptoms. So avoidance symptoms are staying away from places and events that remind you of the experience, right? So, or avoiding thoughts and feelings related to the traumatic event. I can't go there. I can't talk about it. I don't want to talk about it. Or every time I drive through that intersection, I have to pull over into the Walgreens parking lot across the corner and just sit there and try to get myself together. My heart races. I start sweating. I start wanting to cry. That was where that event happened. That was where that crash happened. Or when I go into that room where I was attacked, I go into that cold sweat. My heart races. My mind races. Just can't go into that place anymore. These are sort of avoidance symptoms. Arousal and reactivity symptoms. These are, you remember you have to have a certain number of these. Include being easily startled. Again, I'm on high alert. My head is on a swivel. I'm trying to make sure I know what's going on. And again, these might sound familiar. Feeling tense, on guard, and on edge, having difficulty concentrating, having difficulty falling asleep or staying asleep, feeling irritable and having angry, aggressive outbursts, engaging in risky, reckless, or destructive behavior. Again, these are things that we've heard before with brain injury. And so here they are, replicating as symptoms of PTSD. So we start seeing a little bit about that connection and the sort of the need to, and the importance of looking at the full picture when we're talking with somebody who's has a brain injury or is facing, these kinds of challenges. And then also cognition and mood symptoms. Remember, we have to have a certain number of those in order to sort of get this PTSD diagnosis fully laid out. Again, having trouble remembering key features of the traumatic event. Remember, we talked about that post-traumatic amnesia is one of the signs and symptoms of traumatic brain injury, and can be of other brain injuries, right? So that PTA is sitting here, right, as one of the cognition and mood symptoms that you can display that can trigger a PTSD diagnosis. Having negative thoughts about oneself or the world. This is that sort of survivor guilt, perhaps. Having exaggerated feelings of blame directed towards oneself or others. I should have known better, or they should have done better by me. Again, having ongoing negative emotions such as fear, anger, guilt, and shame. Going back to, here we are wrestling with some of the same things that people with brain injury wrestle with. Losing interest in enjoyable activities, having feelings, which can also be signs and symptoms of depression, having feelings of social isolation. We know that traumatic brain injury and brain injuries in general can be very socially isolating, because I can't go out, because I can't handle the crowds, I can't handle the lights, I can't handle the choices, I can't handle the driving there and back, and all the decisions and all the things that happen that way. So again, we're starting to see sort of this connection, and why it becomes so important, and we'll talk about this a little bit later, why it becomes so important to have somebody who knows about brain injury and PTSD when you're talking to somebody about diagnosing these issues. And then also having difficulty feeling positive emotions. I can't be happy. It was so traumatic, it was so awful. There's just nothing in my life worth being happy for. So, remember that, these are all kinds of signs and symptoms, and you don't have to have all of them. But in order to have this PTSD diagnosis, you need to have certain numbers within, one of this and two, in order to really sort of get that diagnosis. So what are the risk factors for PTSD? So again, it's pretty straightforward, being exposed to traumatic experiences, particularly during childhood. So you can be more susceptible for PTSD if I saw things growing up, if I participated in violence, or there was violence in my home growing up, or, I witnessed difficult and challenging things in my upbringing, right? And so I was sensitized to be on alert, to be aware, to be hyper vigilant, and so that I may be even more susceptible if something traumatic happens directly to me, or if I witness something that triggers those memories. Getting hurt, or seeing people getting hurt or killed. This is another one that was, it's very common within the military. If I'm watching my buddy die in front of me, or, if I'm holding my buddy and she's dying, right? So, or just, I'm in a random drive-by shooting. I'm sitting on the corner and 3 people get shot next to me. Also feeling horror and helplessness or extreme fear. And that's kind of where you're with that, particularly during childhood. You grew up in a sort of horrific environment. It makes you more sensitive and more susceptible and more empathetic with those kinds of feelings and those kinds of events and those people that are going through that, or having it myself. Having little or no social support afterwards. And this is why it's so critical, particularly in these horrific school shootings, that the school jump in with counselors immediately for both the kids that are dealing with it, the teachers, the staff members, the parents, this is so critical to have social support directly after it, to start processing immediately so that it doesn't get, stuck in one place and just fester and just remain undealt with. And so we need to make sure that those get in. Dealing with extra stress after the event, loss of a loved one. So I had my own stressful event in the car crash, my own, that I don't remember, that month I was in the coma, but then I wake up to find out that, my daughter died. I've got to deal with that. Or while I was in coma, I lost my job, and therefore we're going to get evicted because we can't make the house payments. Additional stress can trigger those and can make you more susceptible for post-traumatic stress disorder. And then maybe having a personal history, family history of mental illness and substance abuse. These, again, you don't necessarily have the coping skills. Your mental illness may be such that it's going to make it very challenging for you to deal with and process the emotions that you're being flooded with, determine what your next step is to try and recover and be safe. And then, or just witnessing it growing up, watching my parents, scream at each other, watching my dad try to help my mom recover from an overdose over and over and over again. And that, the violence of that, can just having this family history, or knowing, or grandfather is every time he comes over, he smells of alcohol and he's screaming at everybody. It starts setting you up for challenges. Now, they do talk about, in the National Institutes of Mental Health, do talk about resilient factors for PTSD too. So these are things that can actually work in your favor. And so seeking out support from friends and family and support groups, right? Like we talked about, try and process, trying to get through it right now, as soon as possible. But as soon as you acknowledge it, as soon as you recognize it, it may be, some years later, all of a sudden you see something that triggers a memory, and it sets you off. It sets your body off. It's like, okay, I need to see what I can do. And maybe I need to talk to my friends about it. Maybe I need to find a support group. You can talk about, learning to feel okay with your actions in response. Not everybody's going to respond to trauma in the same way, right? There are plenty of times where something may really devastate one person who was there and may not necessarily devastate somebody else. It may be a challenge. It may be a totally different reaction. And so you've got to at least value your own response to it and say, there's no right way for me to have responded to this. There was the way that I responded and the way that I ultimately want to respond later. And I want to make it different. I want to be different. And I have to acknowledge that I need to process. This is going to take me longer. My father's death in that car crash took my sister 2 years, but I'm still reeling with it. I used to talk to him every Wednesday night. I don't get to talk to him anymore. Every Wednesday night it comes up, and every Wednesday night when that phone doesn't ring, I relive this memory. She didn't have that conversation with him. She didn't have that relationship with him. I do. I've got to be okay with that. She seems to have moved on and got her stuff together. I'm still reeling every Wednesday night when that phone doesn't ring. Bang, I'm right back there. And so we're thinking about those kinds of things, and it's okay. One person, the way that I'm dealing with it, the way you're dealing with it, it's okay. And you need a coping strategy for getting through and learning about it. So you've got to figure out, how best do I need to go to a group, or I just get nervous about groups? Do I need a one-on-one counselor? Yeah, well, I get so confused when I'm sitting on that couch. Maybe telemedicine would be great. I can stay in my own environment. I know my surroundings, and I can still talk to somebody, and I can still continue processing this. Okay, maybe that's a start. It's a way to begin. It's a way to think about it. And then being prepared and able to respond to upsetting events as they occur. And that's sort of getting ready to acknowledge that if I see drive by a car accident on the side of the road, I've got to be prepared that it's particularly driving, in the Baltimore, Washington, D.C. corridor. I'm going to see accidents. I'm going to see stuck cars. I'm going to see people standing by the side of the road outside of a wrecked car. I know that's coming. I need to sort of prepare myself that it's coming. How do I want to deal with that? How can I deal with that best? What can I think about and be prepared to think about when I see that car on the side of the road and those people standing around on their phones, and there's glass and there's chrome on the ground, And in my mind really wants to shoot to lying on the concrete asphalt, looking at the shattered remains of my car. How can I sort of wrestle and do those things? And this is where it becomes so important with finding the right people to work with you on it. So here's where I kind of want to wrap it up a little bit with the connections. Okay, so brain injury and PTSD. So this was probably one of the most interesting things I learned when I started researching for this, and I hadn't really thought about it, but it kind of makes sense. So that in the past, most doctors believed that PTSD could not occur after a brain injury because most TBI survivors had no memory of the traumatic event. That the loss of consciousness or the post-traumatic amnesia, which is part of the mild, moderate, and severe. Remember, it's one of the criteria within those and how you distinguish those buckets, right? You don't remember this. You have no memory of this, and therefore, since you have no memory of this, you have no triggering event. There's nothing to remind you of this. But today, with lots better research and better investigation and acknowledgement of research on PTSD, research strongly indicates that PTSD can occur after traumatic brain injury. That's a wives' tale. It's a myth. And one of the things that's really interesting, I had an experience with a trauma survivor, and we were at an event, and a helicopter came by and landed and took off. And he said he just got flushed and had to take a minute. And I was like, "Hey, are you okay?" It's like, wow, I really have no memory of my car crash. And I was in coma for a week, a number of days. But that sound absolutely triggered something in me, even though I really have no memory of any of the circumstances around it. And I know, having been told afterwards, that a helicopter came, one of the Trooper 1, Trooper 2s that take you to shock trauma in Maryland. One of the helicopters came. I was airlifted off from the scene of the crash. And that's the sound. And in fact, it was one of the Maryland State Police troopers helicopters that goes to shock trauma. They were picking up a nurse to go to a crash. And it was, we were 5, 6, 7 years after the accident. But that he hadn't heard that sound, but that was the sound in his head, and it just absolutely struck him. It hit him hard, even though he was unconscious at the scene, even though he was taken away and was in coma, even all of that sound of that Trooper 1 helicopter landing and taking off, huge rush. And so that, to me, as an acknowledgement of the new research that's coming out, you absolutely can be subject to PTSD and have PTSD when you've had a brain injury. So some of the research that's coming out is that you're almost 3 times, PTSD is almost 3 times more likely to develop after a TBI than other types of injuries. So it's not only possible, it's actually more likely that you're going to have PTSD after a TBI. And one of the research studies says that 43% of the soldiers who suffered a blast-induced TBI, one of the exploding IEDs, met the criteria for PTSD. Only 16% of those research that had other bodily injuries met the criteria of PTSD. And we know that since between 2000 and 2021, over 450,000 service members were diagnosed with TBI. So there's a huge wealth of information, not only contradicting that story, but actually saying that you're more likely to. And so this is why we think it's so important to get this out there, because you may be finding that you don't understand some of the things that are going on. You've kind of learn to adapt with your brain injury. You kind of move forward to live with your loved one with a brain injury. But there may be some other underlying things that could be happening. And there may be, since they mask each other and they overlap, one of the things that we're trying to do with this outreach is to try and at least acknowledge that there might be a connection somewhere, and there might be an underlying opportunity for a different kind of therapy or a different kind of treatment, acknowledging that there may be an underlying brain injury with this PTSD, or there may be PTSD as a result of this underlying brain injury. We're just trying to increase awareness. The possibility is there, and we need to take a look at it. We believe that it needs to be addressed in everyone. So the precise reason for PTSD is not really clear, but research is talking that it says caused by change in the parts of the brain that process trauma. And so after a traumatic event, the brain releases adrenaline or other hormones to give you that burst of energy, fight or flight. I'm either going to run into the building or I'm going to run out of the building. With PTSD, however, the brain kind of gets stuck in that prolonged, heightened state of alert. And so this heightened state of alert causes many symptoms associated with PTSD, this hypervigilance, this hyper-awareness, this panic, this, this always wondering in the world. And so the whole concept of this sort of being stuck in that moment, and the body remembering that moment, or remembering that event, or remembering that long days of events. And so when we get into sort of what is it, can we parse it out? As we said, they share many characteristics: the headaches, light and noise sensitivity, difficulty concentrating, anxiety, depression, and fatigue, feeling tense, on guard, on edge, difficulty falling asleep, staying asleep, feeling irritable, engaging in risky, reckless, or destructive behavior. Your decision making is impacted. And then maybe it's just like, it's just not worth it. I'm just going to do whatever I want. I'm so miserable, I'm just going to do whatever I want. Making these poor decisions. It makes it really challenging when you're trying to, of course, deal with a comorbidity of alcoholism or a comorbidity of substance use disorder. I'm not making good choices, and now I'm making not good choices that have a long-term effect, not only on my mental health, but on my physical well-being as well. So this is why it's absolutely critical when you're looking at this topic to find a multidisciplinary approach under the guidance of a trained neuropsychologist, somebody who gets brain injury, somebody who gets PTSD, and can sort of take a look at the big picture, understand what's possibly going on, and then maybe able to bring in other team members to sort of help out with what needs to be done. And three of the most prominent treatments for PTSD are psychotherapy, talk therapy, medications, and then cognitive behavioral therapy, CBT, which is a little bit more intensive form of psychotherapy. And it focuses on, the harmful thoughts and beliefs that are triggering those negative feelings. Whereas, psychotherapy is more involved with helping you identify the troubling thoughts and behaviors and sort of working through coping strategies and therapeutic strategies to deal with them. So it's a little bit different. And then, medications can always play a significant role in alleviating some of those symptoms. So, like I said, talk therapy uses techniques, when help you identify your troubling emotions and thoughts, and helping change those troubling emotions and thoughts. But that can be very intense, because for people that are experiencing PTSD and don't want to go in there, they don't want to relive that moment, they don't want to talk about it. If that is, what the therapist believes is one of the core issues in order to deal with and process and move through those troubling thoughts and move beyond it, that's going to be a really tough sell. It's going to be a very challenging therapy session. But they can also provide you support. They can get you additional education, provide guidance to other resources, and also, provide actual coping skills. Here's what we're going to try. We're going to try this, this, and this, and see if it works. And if it doesn't, we're going to try something else. But they approach it in a way of being able to sort of solve and provide tools to deal with and move through, those challenges. And some of the medications, U.S. Food and Drug Administration has approved 2 selective, it's called serotonin reuptake inhibitors, or you'll hear about SSRIs, which is a type of antidepressant medication for treatment for PTSD. So they actually tested it, and the FDA gave its approval on these 2 different SSRIs, and that's something that, you can work with your healthcare provider to sort of work through and deal with. You'd need a prescribing medical provider, but they would be the ones that could sort of wrestle with best medications, best dosages. And then of course there's some other medications that can help with some specific PTSD symptoms, as like sleep problems and nightmares. And there's some directly assigned to try and get you back on a circadian rhythm, trying to get you to have restful sleep, not have the nightmares, to be able to stay asleep, go to sleep and stay asleep. And again, these are all very critical. You have to be monitored and treated by a physician or a therapist who knows what they're doing. It's vital to make this successful. And then CBT, and I've actually learned about this through people that are doing CBT. They were really interested in, because what they were finding was the result of their brain injury. They were having lots and lots of negative emotions. There were lots and lots of angry outbursts at their loved ones, angry outbursts in stores, frustration and outrage in just benign situations. And so they sought out this cognitive behavioral because it's more intensive focus on identifying harmful thoughts and beliefs, which are triggering those negative feelings. So really digging down, and it's not easy, because you really are wading into the horror and wading into the terror to try and look at them very closely and figure out why this dropping of a cup at home sets off a 10-minute tirade against your kid. Why somebody cutting you off in the line at the grocery store has security getting called because you just uncorked. And so cognitive behavioral therapy is based on really sort of 3 core principles. That beliefs create feelings, feelings dictate behavior, and then behavior reinforces beliefs. So you have this circle that is created, and if that circle is a negative circle that creates negative beliefs, negative emotions, negative behaviors, and it feeds on itself, then it can really be problematic. And so CBT really kind of wants to uncover those unhealthy thinking patterns, and once you kind of identify those thoughts, then the therapist can help you essentially rewire your thoughts to try and trigger either good feelings or neutral feelings instead, to try and take the sting out of that reaction, to give you that pause that you need to find the space that you need to be able to have a non-negative emotion, to have either a positive emotion or a good feeling, rather than setting you down this path of just screaming and ranting. So it's been effective for the people that I've talked to that have done it. And so it is something certainly to consider and something to ask about. Just missed one. So another way that we're not really talking about, but I think is overall, we've found success in people, in talking with people, both for brain injury and for PTSD, is that a mindfulness and meditation practice can be very effective. And it makes some of the recent studies have talked about that meditation techniques like mindfulness-based stress reduction can significantly reduce symptoms, but it can't be used exclusively as a treatment for PTSD, and it can't be used exclusively for cognitive behavioral issues on brain injury, but it can certainly make a significant reduction in symptoms. And it can feel weird at first, but you've never done anything like it before, but it's certainly worth trying. And the folks that have kind of gotten over the hump and dealing with, I'm just hearing myself breathe. That's kind of silly. If you kind of work through it and focusing on the present and cultivating an awareness of your surroundings and being in the moment, it's training you to be able to not think about that bad event that will trigger you, to think about not looking at that new thing that might trigger an old emotion, but focusing on here and now and your surroundings, and keep your attention on what's happening now and not worrying about things that happened in the past and things that may happen in the future, and sort of take a look at those kinds of things. And so this medium-sized effect, it's significant, but the reality is it can't be done alone. But what it does do and can do, and has been very successful for individuals who really sort of take it seriously, it lowers your stress, it improves your mood, and it can reduce those intrusive thoughts. One of the things that I heard that I thought was most helpful to me, I'm a visual person. So you have the mountain and you have the thoughts or the clouds. And the idea is that the clouds come and they hit the mountain and they keep going. And you don't have to watch the cloud. You don't have to focus on the cloud. It just comes and it leaves, and you let it come and you let it leave. And the trick is coming back to that mountain rather than getting and watching the clouds. You stay focused on the mountain, and the thoughts just come and they just go. And the idea of meditation is not having no thought. The idea of meditation is sort of thinking about that one thing, that one solid focus, and just let, okay, the trauma is trying to come in. It's okay. It's just another thought. It's just another piece of information. Let it go past. Let it go past. I'm not a meditation guru or anything, but those are the kinds of things that I've found to be successful when you're trying to establish a mindfulness meditation practice. So the number one thing, how can I help? How can I find help for PTSD? The number one thing is talk to your healthcare provider about treatment options and follow your treatment plan. So find somebody who knows what they're talking about, work with them and do what they say, and incorporate all the different tools that you find most effective, and be successful. So several things that they may be mentioning in their treatment plan is exercise, engaging in activities that reduce stress, boost health, give understanding, patient, and encouragement, to, like I said, accept that this might be different for you. Maintain healthy routines. Routines can be, if you're just living a frenetic life, you don't have an opportunity to sort of slow down and have a pattern of things, and all that excitement can trigger, can make you more susceptible to getting triggered by things. Just, what's going on? So setting a routine for your meals, setting a routine for your exercise, setting a routine for your sleep. Sleep is incredibly vitally important. As we've seen, brain injury can disrupt sleep patterns. Disrupted sleep patterns can lead to behavioral and irritability and, behavioral issues. We know that when you're tired, you're not thinking as clearly, your cognition is impacted. And so if you have a brain injury and aren't sleeping well, you can have a significant disruption. And we know if you're distracted being on hypervigilance, that can be exhausting. Just having that much adrenaline flowing through your body all the time, you just, it can be exhausting. And if you can't sleep and recover, you're just going to always be exhausted. Set realistic goals. Focus on what you can manage. I can't do that, but I can do this. Maybe I can do that later, but right now I can do this. Focus on that. And expect your symptoms to improve gradually, not immediately. I saw a PowerPoint on PTSD. I'm cured. No, sorry. Unfortunately, it doesn't work that way. And what you may also find in the people that we've talked to is you may go 2 or 3 years and do great, and then feel like, okay, I'm kind of over it. I can kind of back off my routines. I can kind of back off my exercise. I'm going to back off going to therapy. Wham, something happens. You drive by that car on the side of the road and all of a sudden. So you want to sort of recognize that it's gradual. You may need to go back and, get recharged and get reinvigorated and think about things a little bit differently. And then avoid alcohol and drugs. And this is a real challenge in our culture, and particularly, as we're recording this, cannabis is getting ready to be legalized in Maryland. So we're going to be seeing a lot more of it. We're going to be smelling a lot more of it. Well, if that's something that you're drawn to, it's going to be a real challenge. Liquor store on every corner, every football game, they're pouring beer. These are the kinds of things that, the culture makes it really challenging. But if you've got a brain injury, pouring alcohol, putting drugs into it is incredibly challenging, and can create, numerous problems, both physical, mental, and emotional. And even more so if you have both brain injury and PTSD, it can open up and trigger a variety of different things in people. So we need to be careful of that. So how can I help a friend that has maybe brain injury and PTSD? Well, the number one thing you can do is help your friend get the right diagnosis and treatment. And we know that that's got to be done by somebody who knows what they're doing. And so if you think that this person may have PTSD, or they talk to you about these kinds of events that they've gone through, and they talk about maybe they've had a brain injury, maybe a conversation to have, have you thought about maybe you've got PTSD about some of these things, and maybe we need to talk about finding a healthcare provider that can address these sort of issues. And can I help you find somebody that might be able to help you in this regard? Again, you can offer emotional support. Brain injuries, we know, can be very isolating with too much overwhelm, and I can't go out in public anymore, and the driving is too much, and I can't be out after dark. I just can't handle it. And then if I've got PTSD as well, I'm always hypervigilant, and I get easily overstimulated. Again, it's even more isolating. So give some understanding and patience and encouragement. Try to engage them in a variety of different levels. Offer them opportunities to get out in maybe a lesser stimulating environment. Learn more about PTSD and ABI. I mean, you're here at the end of this seminar, and you're listening, and you're learning about this. Learn about what your friend is experiencing. What does it look like? What does it feel like? How do you feel when you do this? What do you see when what's going on? Ask questions like I just did. What are you feeling when you see this happen? What does it feel like when you see this happen? What are your memories? Now, you don't want to trigger them, but you also want to sort of like get a feel for what's going on in them. And you can learn, you can watch other seminars, you can watch other webinars, you can find out documentaries, you can look at websites and find out more about this PTSD ABI combination. And then once you learn those things, to try and reduce the stigma around mental health disorder and reduce the stigma around brain injury, talk to your friends and family and colleagues about this. This is what I'm learning. Right. This is what I'm finding out about. We need to be more sensitive to people with this. These are the kinds of things that they might be experiencing. Share that, because only through education are we going to overcome the stigma against brain injury and against mental health challenges. So I encourage you to, as you learn, share your knowledge. When you're talking with your friend, listen carefully, pay attention to their feelings, be very sensitive, because they may tell you things physically that they're not necessarily saying in words. Learn their triggers. What is it? Smells? Is it sounds? Is it flashing something? Is it dogs barking? What is it? And then how can we create a way of going out into the world where we can either minimize those triggers, or can we pre-script how we're going to deal with them when that does occur? If the random dog does bark while we're walking through the park, if you see a dog running after a ball, and you were attacked when you were a kid, and that just sets you off, we're going to be walking in a park. They're probably going to be dogs. They may be running off leash and playing with balls, or kids, or running around. How can we prepare for that? And then share positive distractions. Again, take walks, go on outings, maybe even attend a class, like a yoga or meditation class, knowing that those kinds of practices might be opportunities to sort of, lower the stress, increase, self-awareness, increase, the ability for them to be physically active, but not overstimulated. Yoga is very physically active, but it's a lot different than a soccer game, playing soccer and pickup soccer game. So think about those kinds of things that you can maybe help your friend with. So I appreciate the time you spent with me. I appreciate, going through these lists and going through these symptoms so that you can kind of get a better picture of both the brain injury and the PTSD and where they may collide and overlap. Recognize that when you're talking to somebody with a brain injury, you maybe need to be aware that there may be PTSD going on as well. If you're talking to somebody with PTSD, there may be an underlying brain injury going on. And if you start relating to them and finding out, or if you're realizing, I have a brain injury, that maybe there's PTSD, or I have this hypervigilance, this hyper awareness, and all this irritability and disruption. Maybe there's a brain injury in that car crash they didn't talk to me about. Maybe when I got knocked down by the crowd running away from the gunshots and hit my head on the concrete, maybe there was something more than just a cut on my forehead. You don't know. Start thinking about those kinds of ideas. If you use the techniques above, many have found effective ways to overcome PTSD. And as a result, they discovered a strength inside of them that they really didn't know was there. And it's incredibly uplifting to watch them have that realization and to have that success with therapy and to then share those successes with others. This is what my therapist shared with me. This is how I was able to get over the fear of the silliness of mindfulness and the silliness of meditation. This is what I was able to do. And sharing that message with others who may have a brain injury and PTSD, or sharing that message with family members who are dealing with individuals with brain injuries, is a very powerful testimony. And it's something that, we see repeatedly. And we are finding that there is significant growth when you allow yourself to sort of address these issues and acknowledge these issues and even recognize that they may be possible. There is a phenomenal power that comes from that acknowledgement. And with the right combination of, treatments, you can, find strength and peace within your injury. And that can really help, improve your own circumstances, improve the circumstances of your family, improve the circumstances of your community. You can enlighten and encourage other healthcare providers to know that this is possible where they previously may not be. And we know that PTSD can be debilitating with or without a traumatic brain injury, but it doesn't have to consume you. And it doesn't have to be the end of your story. So I really appreciate the time you spent with me. I really hope that this was valuable to you. I really hope that it maybe stimulated some thinking on your behalf, things to think about. I know this has been a long time, but I really think it's an important issue, and I really want to thank you for that. And if you have any additional questions about anything you've heard today, or would like some more information about brain injury or more information about PTSD, you can find us on the web at www.biamd.org. You can see our website's got lots of resources on it. And then if you're not finding what you need, you can give us a call at 1-800-221-6443. So again, I appreciate the time you spent with me, and I hope you found it valuable. And thanks you very much. We really, really appreciate the time you spent with us.